Hi, my name is Ida Jean Orlando. I was born on August 12, 1926. I graduated with my nursing diploma in 1947 from Flower Fifth Ave Hospital. I then received my Bachelor's of Science in Public Health Nursing in 1951 from St. John's University. After that, I completed my Master's of Arts in Mental Health Consultation from Teachers College, Columbia University. I've worked as a staff nurse in OB, MS, and ER. I have been a supervisor in a general hospital, and lastly, I've taught and directed several nursing courses. My theory is the nursing process theory. My theory is a mid-range theory. Mid-range theories, which may be derived from grand theories, are less abstract, with relatively concrete concepts, and address specific phenomena across nursing settings and specialties. Relationships between and among concepts can be defined explicitly and measured. My theory is mid-range because it explores the reciprocal relationship between the nurse and the patient. My theory was one of the first to acknowledge the importance of a patient's participation in the nursing process. I focus on changing and improving a patient's behavior. Immediate reactions are also emphasized in my theory. There are 5 major concepts surrounding my theory: the function of professional nursing, presenting behavior, immediate reaction, nursing process discipline, and improvement. The function of professional nursing is the organizing principle. Presenting behavior is the problem that the patient is experiencing. The immediate reaction is the nurse's initial response. The nursing process discipline is the investigation into the patient's needs. And lastly, the improvement is the resolution to the patient's situation. There are 5 stages in the nursing process: assessment, diagnosis, planning, implementation, and evaluation. The nurse will assess the patient by collecting both subjective and objective data. A diagnosis is then made. Once the diagnosis is made, you need to implement a plan of care. Your plan of care will include any treatments needed and the outcome that you desire to achieve. Implementation is the actions that the nurses take in order to reach your desired outcome. And evaluation is how you determine if you've reached this desired outcome or if you need to go back and implement new treatments. The core concepts of nursing theories are person, health, nurse, and environment. My theory focuses on a patient and includes the effects of the patient's participation. The improvement of my patient's behavior and condition is emphasized. The nurse needs to act and respond quickly while communicating with the patient. It is crucial for the nurse to share their perceptions, thoughts, and feelings so they can determine whether their inferences are congruent with the patient's needs. So, a research study that has been done where my theory was used is by Deborah Jean Boschini. She examined the lived experience of nursing faculty that had provided support to psychologically distressed nursing students. According to Orlando's theory, the role of the nurse is to provide assistance to a patient who is distressed over unmet needs. Orlando also emphasized that patients, in this case the students, might not share their needs or fully or accurately, and that it is the nurse's responsibility, or in this case the faculty, to use perception and intuition to uncover the real issue. A real-life situation that implements my theory is this. A patient presents with severe abdominal pain, nausea, and vomiting. The pulse is elevated, but all other vital signs are within normal limits. The patient has been on the unit receiving acute medical rehab after a car accident that resulted in a left below-the-knee amputation. The nurse begins her assessment on the patient and incorporates my theory by asking this patient questions pertaining to a possible diagnosis. This is the subjective data. While assessing the patient's abdomen, the nurse notes tenderness and distension. This would be the objective data. The nurse then asks the patient when their last bowel movement was, and the patient states that they have not been able to have one in a few days. This is also subjective data. After incorporating the patient's behaviors into the assessment, the nurse acts immediately and notifies the provider with suspicion of a bowel obstruction. An ultrasound of the abdomen is ordered and performed, where fluid-filled loops of the intestines are revealed. A CT scan is then ordered and performed, now confirming the bowel obstruction. NPO status is then implemented and a nasogastric tube is inserted. An enema is also administered. The enema resulted in the patient having a bowel movement. In this case study, the preventing behavior was no bowel movement, abdominal pain, nausea, vomiting, tenderness, and distension. The nurse implemented the nursing process by investigating the patient's needs and acting immediately. In lieu of the doctor's and the nurse's actions, the patient's situation was resolved. My nursing process theory can be incorporated and used by nurses every day in the clinical setting. By using critical thinking and involving the patient's behaviors and acting in a timely manner, the patient care is adequate and the patient's behavior is improved or resolved. Thank you.